Good morning. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I want to talk to you a little bit about follicular movement of teeth. It's something that seems like people who do dentistry, and especially pediatric dentistry, pay very little attention to this. But it's a big part of tooth movement, and I want to show you in just a few minutes here a case that we did which explains this quite fully. And I'll start out with the x-rays, really. Excuse me. I'm going to get my voice cleared up here a little bit. This young lady came in 1972, and we realized that she didn't really have room for her teeth. But she didn't have any functional problems, and she was in a pretty good class 1 relationship that you can see here. And so we decided to do a serial extraction procedure on her. And here's where we deal with the follicular movement of these teeth. Now these cuspids, you can see the follicle around them, and they're pushing into the lateral teeth right there. The lower ones are really pushing into these permanent teeth right here. I mean, it goes halfway through the root right there. So what we planned to do was to extract the deciduous teeth around here and also a permanent tooth here. And the follicle moves this tooth out of that space. And I'm going to show you, this is 4 of 72. And I'm going to go now to 5 of 73, which is a year and a month, something like that. And we had taken out the deciduous tooth in this area right here. And the follicle had kind of moved away a little bit. You can compare it. You see where these are in here. Go back and forth over this, and you can see what happens. Now this follicle is kind of like a balloon around the tooth, and it's full of liquid. And if you push it up against something on one side, it'll round out. If there's nothing else on the other side, nothing tooth structure, it will just round out. And it will do that even in bone. So watch that perform here now. This is a year and a month, I think, after we took this tooth out in here. All right, now we're going to come in and eliminate these teeth here, plus the permanent teeth in here, plus all these teeth we're going to take out. Now you think that's terrible, we're going to do that. But she's got wisdom teeth developing, and well, we can't see them at this age. She's quite young, but we feel that she will have them. Now I'm going to erase that, and let's go only 2 months later. This is 7 of 73. 2 months later. Look how this is rounded out now. There's nothing over here, so it pushes the tooth away from this lateral root right here. The follicle is up against it, kind of flat, but it will round out and move over. So the follicle is kind of flat here. I explain this to people a lot of times. If you had your fist in a balloon and it was full of water and you were in a swimming pool and you pushed it up against the side of the swimming pool, it would flatten out on both sides. But if you took your hand away and left it alone, the balloon would again come to this circle and push your hand back away from that. That's exactly what's happening here. The tooth is being pushed away from this solid surface right here and here. This tooth is moving in that direction. These teeth that were way over underneath here have already, see the follicle flattened out right here and is shoving them over in this direction. It flattens out, shoves us in this direction. Now this is important, so you're going to watch these teeth come in. This is only 2 months after we took the other teeth out. I'm going to go back now. I just wanted to kind of remind you, see where those cuspids are. We took those teeth out, and then 2 months later, watch the follicle on each of these, and look how they move back away in just 2 months. This is, I'm not putting anything in there except just guiding the direction of them. Now you can see the wisdom teeth developing back in here. And so we don't worry about not having teeth. We're going to have plenty of teeth to put in the mouth there. So let me go back to, all right, that's 7 of 73. Now let's look at it a little bit later on. Here is January of 74. Now that was 7 of 73. So we've got 5 months in 73 and January, so that's about 6 months later. Look where these teeth are. Look at the circle around the teeth. And the follicle will come down here and open up and become the epithelial tissue around the neck of the tooth. Look at these teeth. They're even pushed back away from the teeth right here. Each of them is pushed back away. If you don't understand this, just take this and go back and forth so you can see what's happening now by this little sac of fluid around those teeth. You push it up against something or you take something away from it and it forms a circle and it pushes the tooth back. So we use follicular movement of teeth. It's something that I just have never heard anything about anybody writing about it or talking about it, but look what it does for you. Now, let's go a little further. This is 7 of 74, and we'll go to 2 of 75. So this is a few more months later. These teeth have moved. The bicuspids have come in. The cuspids are lined up almost ideal. They'll come into this space now. The permanent teeth are eating the root of the second deciduous boulder away, and I noticed a little piece of root right here. Don't pay any attention to that. That'll continue to resorb and go away. Okay, let's take another jump here. It's 2 of 75, and here is 8 of 75. And the little piece of tooth is gone. There's nothing much here, but the top of the deciduous teeth here and here and here. Now our wisdom teeth have formed pretty good back here, and so we pretty well knew that was going to happen. Now, it's 8 of 75. Let's look at it just a little bit later now. Here is 4, 5 of 77. And the thing is in there and the space is closed up, and we have not touched this case other than guided the eruption of the teeth. And we had somebody that was in class 1. They functioned right. If you'd been sucking your thumb or you're breathing through your mouth or some other functional problem, this wouldn't work this easy, but it will work. And we did nothing to this young lady, and her teeth looked quite well. And I've done this on people that were children missionaries or people that couldn't possibly get orthodontic work, and we would do this for them. I did it on a surgeon in Africa. He came in and he helped me do this on his daughter, and his daughter's teeth came in nearly straight. When he got out and came back to the States, he had them touched up some more. And this young lady here has hers. Her dad was, I did his teeth, and later on hers weren't perfect, but he came in and had us come back over and finish them up ideal. But they're just darn near ideal like it is. So this is something you should take seriously and learn how to do it. It works many cases that you need to use follicular movement of the teeth. You just have the hard surface, which has to be a tooth. Now it'll move through bone. The follicle will move the bone out of the way, but it won't move a tooth. Usually. Now, sometimes the permanent tooth will eat another permanent tooth up, but not very often. It will develop around in baby teeth. It just moves the root, just does away with it. Now, this happened without me touching this case, and there'll probably be plenty of room to bring the wisdom teeth in. This is the case in 1977, and here is a young lady in 1995. That's 77, 87. Oh, it's about 18 years later, and I had straightened them up, but she hadn't worn a retainer. I don't guess it wore one hardly at all, and there's a little flaw in it, but her teeth are pretty well straight. You see, this is, if she had worn a retainer good, that wouldn't have happened, but she's not used to wearing retainers, and the teeth have moved to some, but this is 1995 to 77 when we got through with that. So I want you to realize what you can do with very little, but using nature to help you straighten teeth out. That's what you need to learn how to do. That seems to be hard for a person to learn. I don't pay a whole lot of attention to the cephalometric stuff. I've looked at it so much that I can almost tell you what to do before you even take one. But I do take them, and I take a lot of Panorexes. So anyway, I hope you'll learn something from this on follicular movement, and I'd like to hear from some of you that have tried this. This works. So I'm going to say goodbye, and thank you for watching, and join our group, and join our, subscribe to our deal, and join the American Orthodontic Society. Thank you for listening, and I'll see you later on. Thank you now.